Good afternoon, everyone. Thank you for joining us. Want to go over some data, touch on a couple points, then we'll take some questions. Certainly, today is a tough day. We have lost 3 neighbors to COVID-19. We lost 3 women. One African-American woman in her 80s, one African-American woman in her 60s, and one Caucasian woman in her 80s. We've now lost 33 people to this illness. Just want to let the families know that we're thinking about them and certainly praying for them. The reality is that when this virus gets into pockets of our community, with folks with underlying medical conditions, no matter what their age, or folks who are frail and elderly, it is brutal. And we know this. That's why we're doing many of the things we're doing to mitigate the spread in our communities, specifically for our seniors. Looking at cases, we've been doing proactive testing. We've been finding the cases. We're finding pockets of individuals that are asymptomatic so that we can stop the spread in these vulnerable communities. With all of these actions, we will have more cases. We now have 920 cases. That's up from 876 yesterday. That's 44 more cases today. Hospitalizations, we have 38 individuals in the hospital, down 1. Representing 12% of our active cases. Part of a restart looks at your hospitalization rates. You need a downward trend. We've already experienced that. We can already check that box. Certainly, as that box was checked for elective surgeries to begin. Our hospitalization capacity is more than stable. It's in excellent condition. We have 8 individuals in the critical condition. That's the same as yesterday. This is now representing about 2% of our active cases. Out of the 38 individuals, we have 21 Caucasian, 7 African American, 2 of another race, and 7 individuals who have yet or have declined to share their race with us. Today we have 561 people who have recovered. That's our green curve. That's up 11 individuals from yesterday. So we now have 920 positive cases, our red curve. We are presently monitoring 326 active cases. That's the yellow curve. We now have 114 individuals who were household contacts of a positive case that have tested positive. Why do we differentiate this number? Again, these are folks that were already in a quarantine. Our health department's ability to have to go and trace is limited in these situations. So these are essentially already isolated individuals. The risk to the rest of the community is not large. 25 of our new cases are affiliated with senior living facilities. We've seen this. We've been making a lot of progress testing these facilities. The state of New York's been doing a lot of testing, and so we're finding cases that we wouldn't have otherwise found, and confirming concerns that we had about other facilities that there may be active cases there, and we needed to get our arms around the issue, and that's what we've been doing. So 44 new cases today, 28 related to affiliations and or contacts, 16 cases related to community spread. Reminder on community spread, this is an indicator of where the randomness of the virus is. What can we do to really help starve the virus in this regard? Certainly physical distancing. We know 6 to 7 feet. It's something that's going to be the new norm when we get into restart. We've been doing it. We need to continue to do it. That's just the way life is until this virus is gone or we have treatment for it. Washing hands, probably even a more effective way as well. Please continue to wash your hands good hygiene, and certainly masks. I know that we've been doing, and we've been getting a lot of the masks out. A lot of people are doing this. We still get a lot of emails from folks related to masks. Just a reminder that some individuals who aren't wearing them because they have respiratory illness, asthma, whatnot. Certainly, that's a reminder that there are individuals out there who can't wear them. Most individuals can. I think when we look at our active cases, our curve from our region, flat curve, green curve going up, still red positives. The reality is we're going to have more positives even when we have a restart. Why we do phased-in approaches is because we have to see what happens when we bring more people into the day-to-day routines of the local economy. How does that impact our positive cases, which then impacts our active cases? So looking at the active cases, you need to understand your active cases to be able to understand what mitigation tools you can implement, if any, from our position. 326 active cases, 70% are now related to affiliated, essentially, buildings and or affiliated living centers for seniors. That includes contacts as well. So to give you an idea, out of 326 actives, 228 of our cases are essentially related to affiliations. Why is that different from community spread? It's different because these are already situations that are already contained and quarantined. Our senior buildings are already quarantined essentially from outside the community. That's why it's different. Our health department's ability to fight the virus in real time is not impacted as greatly with these facilities. In most cases, it's not impacted at all because they have their own medical staff and medical teams. So there is a difference between these affiliated cases and then community spread when it comes to fighting this virus and next steps with this virus. But I think it's important for people to realize is that the virus is still here. Our community spread cases have stabilized, dropped a little bit, week over week, but they're stable. We can fight this in real time with this workload, but you don't want to get this virus, and you want to do everything you can to protect yourself and your family from it. And certainly, the more we do to mitigate the spread, the more success we'll have. When we look at the cases, 518 are female, 402 are male, 28 are under 19, 163 are in their 20s, 119 are in their 30s, 123 are in their 40s, 152 are in their 50s, 142 are in their 60s, 88 are in their 70s, 71 are in their 80s, and 34 are in their 90s. 21% are under 30 years of age, 34% are under 40 years of age, 47% are under 50, 64% are under 60, 36% are over 60. Breakdown by municipality. Mind you, some of these municipalities, new cases are related to these affiliated cases. So that skews their data. City of Syracuse, 439 total cases, 231 recoveries, 208 active. Town of Clay, 87 total cases, 63 recoveries, 24 active. Town of Onondaga, 70 total cases, 24 recoveries, 46 active. Town of Manlius, 53 total cases, 38 recovered, 15 active. Town of DeWitt, 47 total, 29 recoveries, 18 active. Town of Salina, 43 total, 31 recoveries, 12 active. Town of Camillus, 34 total, 28 recoveries, 6 active. Town of Cicero, 29 total cases, 25 recoveries, 4 active. Town of Geddes, 29 total cases, 21 recoveries, 8 active. Town of Lysander, 28 total cases, 18 recoveries, 10 active. Town of Pompey, 21 cases, 20 recoveries, 1 active. Skaneateles, 15 total cases, 13 recoveries, 2 active. Van Buren, 5 cases, 2 recoveries, 3 active. Lafayette, 4 cases, 2 recoveries, 2 active. Marcellus, 4 total cases, 4 recoveries. Atisco, 4 total cases, 4 recoveries. Elbridge, 2 cases, 2 recoveries. Fabius, 2 cases, 2 recoveries. Spafford, 2 cases, 2 recoveries. Tully, 2 cases and 2 recoveries. Again, geography has been, the number of cases have been impacted by affiliations within those towns and the city of Syracuse. That's what is driving what would be otherwise trends. Besides that, you break those out, they're pretty solid related to population. Testing, we've talked about testing. One of the criterias for restart, we believe we met that criteria for the ability to have robust testing. Importantly for us, the ability to get testing back in a timely manner so that we can isolate, trace, and quarantine. Certainly, the testing, we have 676 pending tests out right now related to our proactive testing for the most part. And certainly, we expect there to be more positive cases. What we've seen now is we've now seen at least 50 asymptomatic cases from our proactive testing that's included in our active cases. So these are individuals never going to go get a test. Why? Because they aren't showing any symptoms, but there's the potential, not the guarantee, the potential for them to be able to spread the virus to other individuals. So now we know where they are, we know who they are, we get them in quarantine so we can prevent the spread that way. So a lot of this proactive testing, this is what we're finding, and it's important as we move forward to trying to continue to limit the spread of COVID. There's questions about Walmart. Amazingly enough, people write an article, they call us up, tell us that they've given us a total number of tests. Over 900 tests have been completed. We're going to have some more data tomorrow to talk about the positives that have come from that site, and we'll have more information on the negatives. We've been receiving the positives, like we said, this whole time. We're interested to get all that data confirmed. What we believe is that the percentage of positives at the Walmart site will be less than everything else we've seen because of the looser guidelines. But we'll be able to talk about that more tomorrow, hopefully. We talk about gaps in an investigation. A reminder, when you're a positive, you're going to hear from our health department, check in on your health, your symptoms. We then begin to do our contact tracing and our investigation. From that, we'll determine quarantines. And so if there's a gap in that investigation, we're going to tell the public, so as a reminder that we need to be cognizant and there's still community spread. So here are 2 examples. Both these individuals were wearing a mask. One of them was an employee, one of them was a shopper. So if you were at the Cricket Wireless, the Empire Plaza, 3150 Erie Boulevard East in DeWitt, on Wednesday, April 22nd, from 11 a.m. to 7 p.m., or Thursday, April 23rd, from 11 a.m. to 7 p.m., there was an employee working that is now tested positive for COVID-19. What does that mean to you? That means you need to be cognizant of your symptoms, take your temperature, contact your doctor if you believe you may have symptoms for further guidance. That does not mean you had a direct contact with the employee. We just want to bring this to your attention so you can be cognizant of your surroundings. In addition to that, we had someone who shopped at Price Chopper, 2515 Erie Boulevard East in Syracuse, on Saturday, April 25th, 9:30 a.m. to 10:15 a.m. 45 minutes if you're shopping at Price Chopper on Erie Boulevard this past Saturday from 9:30 to 10:15. Someone else in the store had COVID-19. They were wearing a mask. That does not mean you had direct contact. That does not mean you're exposed, but you should be watching your symptoms, and certainly if you are concerned, contact your doctor for further guidance. We talked a little bit about social distancing, physical distancing. It's a mitigation tool. We know it works. We know it's going to be part of restart. So for us to continue to keep our community spread, caseload stable. We need to continue to be smart, continue to do it. There's going to be more and more pressure as the weather gets better, and I understand that. I'm cognizant of that. We have to be smart. Last thing you want in a restart is you've been working, waiting to get back to work. You get back to work, you get COVID, you're right back home for another 2 weeks. Okay, so let's be smart, and let's continue to do this. Let's continue to fight together as we're doing this. We've been talking about regional restart, continuing to move towards that, meet the necessary mandates. We believe we have. We believe we're ready. We continue to meet those mandates. We continue to have dialogue with the state of New York on what that means for us here in Central New York, and certainly our partners in the Mohawk Valley. Again, I want to thank all of our county leaders. Tremendous leadership from all of them in Oswego, and Madison, and Cortland, Cayuga, certainly Mayor Walsh, and then our friends, County Executive Pacenti in Oneida County, and all of his partners in his region. Just tremendous leadership from all of them, putting a lot of work into this process. We've seen about elective surgeries resuming. This is good for public health. This is good economics. This will get workers who are furloughed back into work. This will help with our supply chain for these hospitals, as well as some of their products will be in demand. So certainly we're pleased with that, and we'll continue to work with the state moving forward with other regulation recommendations from the local levels with what we're seeing, with how they can potentially loosen some things up. Childcare. We're now extending our childcare program through May 31st. These are slots that are free for essential employees. We have slots available. This is free daycare. By doing this through May, when we get into that first phase of the restart, we'll be able to help bridge that gap in childcare with many of our employees that will be going back to work. And again, we talked about testing, the key of testing. Certainly, you're sick, symptoms, no health insurance, contact the Upstate Triage Hotline, 315-464-3979, to get referrals into the Syracuse Community Health Center for testing. Our seniors and our healthcare workers and our adult nutrition hotline, really a hotline that is filling the needs in so many different ways right now for the community. 315-218-1987. If you have a gap, you need a meal, you need groceries, you're running out of toilet paper, some of these things that we've seen, call. We'll try to source these things. We'll try to use our volunteers to help you get through that need. We talked about daycare, childcare solutions. This is what you call. You running into a daycare issue, we are extending our program free of charge. There's no income criteria on this. 315-446-1220. Please contact that. And again, 211 for social and emotional support. Very concerned. We know people are having a hard time. We know the kids are having a hard time, and that means that's more pressure on the parents. And then, so anything you can do, don't be ashamed to call 211. Call 211. They'll get you proper referrals. They'll help you deal with things and strategies. Questions?
Another day, unfortunately, more consistent deaths. Yesterday you indicated it's the types of places where these people with underlying health conditions live. Are these deaths consistently happening with people connected to a nursing home or other elder care facility?
I think by the ages we know they're consistently related to, and by underlying conditions, are related to senior facilities. And so part of what we've seen what happened throughout the rest of the state, we knew this virus is just lethal to these populations. We're getting out, we're identifying asymptomatic folks that may have been spreading this, not knowing so, to other folks. and then these folks don't do well, they end up in the hospital, and we're losing neighbors to this fight. So by what we're doing is we're finding these hidden pockets, and we're essentially protecting, by identifying this now, we're protecting others in these facilities that most likely would get exposed if we weren't doing what we're doing.
Are the logistics and setups in these facilities appropriate right now? Is there any kind of discussion about what could be done better in these facilities? Obviously, testing and pulling sick people out is a critical part. You're already doing that. Yeah. But moving people around, reducing density, it sounds hard, but what can you do? Well,
so in many of these facilities right now, they're working with our health department and the state health department. And I will say that the response, since we've been, our proactive response hasn't just been us. New York State's been proactive with testing and working with and relying on our expertise in some of this area as well. So we're very appreciative that they're working with us and essentially been doing some very robust testing of individuals we can't test. So we're very pleased with that. But I don't know best practices, Andrew. After certainly, I'm sure these owners are going to have to work within their industry, work within their regulators on getting through today, and that's what we're doing now with these facilities. Hypothetically, these individuals, if they're COVID positive, should develop some sort of immunity potentially. Not all of them will. That doesn't mean, we don't know enough about the antibodies yet, right? We don't know if that gives you immunity, but there's a belief at least it does for some. But moving forward, once we get through this and we start to move into the next phase of restart recovery, we'll still have COVID, but that pressure won't be as great as it potentially could be again late fall, early winter. And so I think certainly you learn from every decision you make in this process, and you adapt with that knowledge, and you prepare better for what comes next.
Your friend Patrick Penfield donated his recovered plasma last week. He got the call a day before, and it said someone needs it now. Have you heard any reports from upstate about this plasma being injected into a very ill patient and any improvement in their condition because of it?
Yeah, I know it is being done, and I know when you look at all of the other day, and I'll get the number tomorrow, I think we had 111 recoveries from the hospital the other day. Part of that is because of the plasma project, what's being done. And certainly folks like Patrick, they have the ability to help more than even we can, right? So just want to thank him and everybody who's done that, because they have saved lives. The actions that we're doing by identifying these hidden pockets is saving lives. And that's our number one goal right now. And so certainly our COVID positive patients that recover, they have a special ability to be able to help out their neighbors. And I believe it's working.
For those 50 asymptomatic cases, do you know where those tests were done?
Collectively, I'm not sure exactly where they've, all of them have been done, but certainly you're getting some of these folks are in our proactive group. So Essentia Health's going in, doing that, going back to Syracuse Community Health Center. That's where the majority of them are coming from. Certainly the state's doing testing within their buildings that they regulate, and some of those are from those. I don't know about the Walmart site yet. Again, early indications show that the Walmart site's not going to have the same percentage of positives that these other sites have. We'll see if that holds true. But yeah, these are folks that, just like you and I, are here today healthy, and they could be spreading this virus. And so when people think about you're not allowed visitors, you're testing the employees, how does it get here? You could have had an employee who was asymptomatic, give it to, but then gives it to somebody else who's asymptomatic, and then they're giving it to other people. It spreads like wildfire. So good news is we're getting to a point where we're on top of this. There's not that from our most vulnerable buildings that have had positive cases, there's not that many tests to come back from these buildings. Most people have been tested. So, it's sobering when you see how many people have it, whether they're asymptomatic or not. And when you see the breakout now of our active cases, 70% are from a small pocket of the community in the most vulnerable pockets.
How's the staffing at those senior facilities?
I have not heard of any issues with staffing. I think this latest go-around of cases isn't driven by the employees. It's more the residents of these facilities. But certainly we've communicated to all the assisted living facilities and even many of the nursing homes that if there's a problem, let us know. Let us help you solve the problem. And certainly we're prepared to do different things to solve problems to make sure that our vulnerable buildings with our vulnerable residents are getting the proper medical care.
Did you just say you're nearing the completion of hitting all the senior living places you want to hit?
We're going to keep hitting. There's a lot to hit, especially when you do independent senior living. But when you look at the buildings that have had cases, if we're not done, we're pretty close to being done with those. And now we're going to other buildings that haven't had cases. And maybe there's a case or two we find there. But when you look at some of the areas we knew we've had exposure, we're there. We got the numbers.
So are you expecting to see a decline then in the number of new cases you're getting? Because this has really driven an uptick. Really.
Yeah, I think we got another couple days of higher numbers, and then we'll be back to a better idea of what just community spread is. And the community spread numbers have been stable, if not downward trending. Today was a bigger day than what we've had community spread in a while. But again, 2 weeks ago, if we had 16 cases, we would have said, not a bad day. So the overall, once we get through, and here's the other thing, all these facilities haven't been allowing visitors essentially. So we don't have a strong belief that these facilities that haven't had cases have them, but we're just testing. This is what we're going to be doing moving forward, right? We're going to be doing testing to test, to find, and then to trace. So this is a good exercise for all of our teams right now.
And have you heard that the state has gone through most or all of the nursing homes too with testing?
I believe they've gone through most of our larger nursing homes and tested. Yep.
Because testing is a moment in time, is there any thought to testing people over again proactively in, say, 2 or 3 weeks?
I think you're going to see with employees, you're probably going to, I don't know if it's in 2 or 3 weeks, Andrew, but certainly you'll see employees consistently, especially in these facilities that are, so dense, and there's nowhere for people to really go. It's very hard to physically distance. I think you'll see employees consistently being tested.
Have you been tested?
I have not been tested. I have not. I'll let you know. The fact that I have it means I don't have symptoms, Trish, okay? So if I get tested, it'll be because I have symptoms, not because we're doing proactive testing on me.
Ryan, why are you expecting a lower percentage at the Walmart site? You said they have somewhat looser criteria. What do you mean?
Yeah, you're not talking to a doctor, and you're not essentially being screened. So you're online going through your CDC guidelines, and we're doing proactive testing there with employees and first responders. So that's a mindset. You have people who may be exposed to folks who have COVID. They got PPE on, but from a mental health standpoint, they go and get tested. So they didn't necessarily have the CDC symptomatic guidelines either. So that's where I think we'll probably see, whether it's a percentage lower, 2%, 3%, we'll hopefully have our arms around those numbers. But I think overall, when you look at testing overall, we're over 3% of the population. I know, probably approaching 4%. Compare that to other counties, it's pretty good, especially when you look at the number of cases we've had. A couple of the downstate counties that are smaller than us but have had triple the cases we've had have 3%, 4%, 5% of their population tested. So for us, we've had a bunch of cases the last week or so related to really our proactive testing, but for a community our size, 920 cases total is, 0.0025 of our population. We're doing pretty well.
You mention affiliations. You use that word a lot. Does that solely mean people within the same building?
Affiliations is what I'm saying with affiliations now is essentially these facilities that are affiliated cases within those facilities. Those facilities being essentially senior real estate driven towards care and or permanent housing as well.
And including employees and residents.
Correct.
The governor said this decision for schools was going to be made by the end of this week. Do you have superintendents on standby kind of for when that decision is made to talk to all of them about what they're going to do moving forward?
Yeah, we're going to need to certainly probably implement some sort of proactive testing strategy based off of that decision. And so there's quite a few superintendents we have very good relationships with. We are always, Dr. Desiato, really the dean of our superintendents, certainly Superintendent Elisea and Potter from Liverpool and the city of Syracuse are people that we talk to, and as do we with others. But certainly once there's guidance from the state, we then need to look at a testing plan and strategy, what that looks like, what makes the most sense, and then certainly how are we going to do physical distancing in buildings, because that is a problem. The kids do better. The kids are most likely carriers that can then bring it into other pockets of the community.
Do you have any knowledge of his decision, or will you be finding out just like everyone else when he
My
announces it?
guess is that I will find out in real time with all of you.
You're talking about physical distancing at schools, and that seems to be something that you're going to have to implement, whether it's later this month or in the fall.
Yeah.
So are those conversations happening, and what do they?
Yeah,
sound like?
that's the challenge, and so I know the superintendents are thinking about it. Certainly, whatever plans they come up with, our health department's going to need to review those, and certainly testing. It will be easier in the fall to do proactive testing of employees. Is there value in testing kids proactively? These are all decisions. These are thousands and thousands of people. So these are all things that we'll lean on our medical professionals as they learn more about the virus. But these are all concepts that are out there that are going to have to be dealt with. Yeah, so we have different, and again, and it's important that we understand how this restart looked like, because I got a lot of people who are confused about each person's role in restart. Remember a couple weeks ago, there was a debate with who's in charge of restart. The president said he was in charge, but then the president said states are in charge. So he didn't say counties were in charge. And so he didn't give us the ability to go decide what businesses get to start up in our county. And so I think people are confused with that. I think people think I can say, we're going to restart today. All you businesses can do that. I can't do that. I would probably like that ability, but I don't have that ability. The President of the United States gave that ability to the governors. The governor has said, work as a region. We've done that. We've put forward a plan that we believe we can safely bring on more businesses in phase one than just construction and manufacturing. The governor is going to need to agree with that, and agree because if we're first, what we do will impact the rest of the state when they do it. Same guidelines, same regulations. You can't give different guides and regs to one region and not the other region. So however we restart Central New York will have an impact on New York City and Long Island and the Hudson Valley. So that's why the state has to be on board, and essentially we've talked about our plan, and that becomes the state's plan with whatever the final decision is with restart or reimagine for Central and for Mohawk. So we think we can do more in phase one than what's been talked about, but that has to be an agreement with the state of New York because of the authorities that folks have. Now, can counties not be leading in restart? It's impossible for us not to lead in restart. We're the ones doing all the work with our health departments, our emergency management departments, our social services. And so restart can't just be a committee or this or that. That's the next phase of economic recovery. That's when you need the private sector to look at it, and you need the governor's talked about reimagine New York. So our role in restart is to give our own plan based off of the specific nature of our economies here, and our plan has a lot of feedback in from the private sector, but the health department's got to feel good about it. And so we give that plan. The state then massages that plan into their own vision on how it impacts the rest of the state and the rest of the regions. So folks who get mad at me because I haven't been able to restart the economy on May 1st, the reality is that the president gave that power to the governor. And the governor has that power because he's got what happens in one region will impact the other regions. So I apologize I can't start things up. Not saying I would anyways, but that's the reality. That's our role in this process.
When you look at that list of 130 people who are on the governor's restart team, what do you think of it, and what conversations have you had with some of those Central New York locals?
Yeah, so I know all four of the Central New York folks very well. So specific to our plan that we put to the governor's team with all of our concepts, I haven't talked to them about that yet because we're waiting on feedback. We're waiting on more dialogue. I think the Reimagine New York Task Force is kind of that bridge from restart to recovery. And so certainly I know Fannie Villarreal, and I know Linda Brown Robinson and Melanie Littlejohn, and I've met once or twice Joni Mahoney. So certainly we'll have those conversations and we'll share the work we've done. This isn't recreating the wheel. We've been doing this. We were the first community to have these conversations with the state. We put a lot of work into it. We're the ones who are doing the work, so we're the ones who know how you can do a restart successfully and not lose the gains you've made related to public health.
Does the death toll include people who died outside the hospital?
I'm not quite sure, Andrew, on that. So I'm sure there is probably cases in there that folks weren't in the hospital when they died.
If there's a nursing home death, it would be reflected in that total?
Correct.
And we're learning more and more. We're learning about more and more restaurants or other businesses trying out drive-through style service, setting up in parking lots. We saw the success of Pizza Free last weekend. They're doing it again, moving it to the fairgrounds. If more and more businesses jump on to this bandwagon, it might be the only way they're making money in some cases. Do we risk undoing some of the progress? Is there a risk to that? What would you tell people to watch for? And at what point do we need to control those operations, the number of them, in order to not spread the virus?
So we're going to regulate these, and if it's, your point is taken, this might be a way they make money to pay their employees and support their families for a month because it's easier that way. So certainly we're going to regulate these in a way, make sure that the folks have the right PPE on or masks on, gloves, making sure people aren't getting out of their cars, doing things smart. And if this becomes the trend, and look, this might be the trend. I had somebody say, the Taste of Syracuse, why don't you take, whether it's the fairgrounds, the Orange Lot, have the Taste of Syracuse be just like that? just like the pizza free, right? We know how good pizza free is. You go and you can do your samples and then go out that way, and you can do that. These are all good ideas, and what we're dealing with COVID-19. You got to do it in a safe way. And so as these things come up, our health department's going to give a lot of guidance, and there's going to be a lot of regulation related to it, because certainly there's a greater risk with all of this than what there used to be with food inspectors.
You say regulation, but I can already count in my head 3 that I know of doing it between Friday and Sunday. Does that mean Does that mean they've gotten clearance from the health department? Does that mean they should be having a conversation with your office? What should the protocol be?
Yeah, I mean, they should have a permit, first off. So that by doing that, that triggers our inspections and whatnot. So certainly we're aware of some of them and communicating with them.
The word you used was yummy, by the way. I'm bringing back a previous quote about pizza free.
Very yummy, very.
So if the date is May 15th, Onondaga County will be ready?
Yeah, we'll be ready. And when you look at our data, our healthcare data is solid. We're one of the only communities out there proactively looking for the virus to continue that path, to avoid those plateaus in the future that the governor has alluded to. I think it's like 0.025% of our population has contracted the virus, and our hospitalization rates have already met the criteria, the CDC criteria that was talked about from our peaks with a 14-day downward trend. And so we're doing things that, again, we're mitigating now with testing and doing that before most communities are doing it. It keeps us ahead of the curve. So with all that, with proactive testing, you're finding the asymptomatics. It hurts your numbers. Kind of sobering reality that there are people out there without symptoms. But I think it's good for the community to realize that it's still here. And it's going to be here until there's either a vaccine or an antiviral treatment, and that means it's still here, or it's going to fly away and it's going to come back. So we just got to be smart, and we know it works. And part of the reason, I just want to remind everybody, part of the reason our numbers have been good and we don't have overrun hospitals. Sure, some of the analytics were off, but part of that is because of the excellent work that was done, planning and preparing, mitigating, and the excellent work by our first responders and our healthcare professionals getting people better. And if we weren't doing these things collectively as a community, these numbers would be a lot worse. So I understand all the arguments, but the response till this point has not been heavy-handed. It's been well thought out, data-driven, and now we're using that same data-driven approach to recognizing our region, for as large as we are, is in a very solid position to lead in a restart.
So elective surgeries can go ahead. Is there any chance that things like dental appointments and eye checks and things like that can happen before the 15th?
I don't know, Tim. This is the type of kind of ESD regulatory guidance that we talk about, that when we see something that we think makes sense, we push the state. We ask the question multiple times a week. And that's something that certainly we've seen each kind of economic industry or business group, from hair salons to tattoo parlors to restaurants, giving out safe guidance. And I say, when you're giving out guidelines how you can do your business in a safe way, with COVID-19 being here in the community, don't just think of you doing it here, but how do they do it in New York City? Because that's what's really happening. If we're going first, what they do here is going to apply for the rest of the state. So can you think about, you're in New York City, under that type of population demand, the guidelines should be reflective of all that as well. So, we're getting there. What was that? Yeah, I think that's one. We've put ourselves in a position to to do it. And the reason is because one of the reasons why going first makes sense here is because of our robust medical infrastructure and our health department and our health department's ability to do their job in real time. Again, there's 326 actives. You're really looking at 100 active cases right now that are requiring, our health department infrastructure. The other 228 cases, for the most part, don't require a lot of that infrastructure. So we have a lot of capacity to deal and fight with this virus right now. And we have this robust medical infrastructure that supports all central and northern New York. And it's in good shape. We got great doctors. And we got great community residents donating plasma. So when you look at it all, why not here? We've done a good job to date overall, everybody in the community, and so why not? The data merits it. Let's do it here. Let's learn from what we do here. Take those lessons to other parts of the state.
What did you say about Walmart giving you data? Did they bring you up to date?
They gave us a total test number. So we're going through our positives and figuring out how many came from that site. And then they're supposed to help us with the pending number. So then we can figure out the negatives. So there's been many of those 900 have come back through. So that's something that sometimes articles get written and people respond quickly. Thank you.
Do that regularly, or?
That's what they're supposed to be doing, yeah. Other questions? Okay, a lot of families are adapting to being teachers as well as parents. Stressful. So I wanted to bring the attention for our elementary age students. A lot of kids don't understand why they're not in school. They can't see their friends, go to the park, play with everybody. I want to thank the Wisdom Thinkers Network and Ralph Singh for making Help Slow the Spread with Snappy. Practice self-control. Snappy is a turtle. And so this is a free of charge lesson for all the kids. It's a great tool for learning. And there's a poster contest. How you do this is you go to www.wisdomthinkers.org/snappy. So again, thank you for everybody. This is a good way to give your kids something to do and get on there and help explain what's happening in a way that our little ones can relate to. So saying that, thank you and be safe.